Hello, welcome to any community. In this particular video, we are going to solve one particular puzzle. The case scenario of this puzzle goes like this. A 40-year-old male suddenly presented with pain in the epigastric region since 4 days, which is of burning type, radiating towards the throat region that through via retrosternal region, which aggravates on consuming the pickle or gobi Manchurian, etc., and getting relieved by taking Pitta Shamaka medicine. And this is associated with vomiting 4 times of the vomiting almost occurring every day. Initially, it was being nearly 7 or 8 times of vomiting. Then it is on the second day it was the 6 times of vomiting, and on the third day it was of the 3 times of vomiting. So, uh, what might be the Srotodushti afflicted? So here, the examination findings was the patient had the tenderness in the epigastric region initially. The first day, later he was not having that particular tenderness as such. So what kind of this Rotodushti that may be affected? Is it Atipravritti, or is it Siragranthi, or is it Sangha, or is it Vimarga Gamana? Pause this video for a while. Now, the answer to this particular question. So it is being mentioned that 40-year-old male individual. So this particular age group lies between 30 to 60 years. Of course, as such, it is the natural dominance of the Pitta dosha. And the person is having the pain in the epigastric region since 4 days, which is indicative of that too it is of the burning type, which is indicative of again Pitta dosha dominance. The there is radiation of the pain is happening towards the throat region, and which is actually aggravated on consuming the pickle and gobi Manchurian, etc. Getting relieved by taking the Pitta Shamaka medicine. All these are indicative of the person is having the Pitta dosha prakopa. So here this was being associated with vomiting. When you think about this, so this is actually there is a association of a pranavata dysfunction. Along with udanavata, the person is having the chardi or vomiting. As far as the Srotodushti is concerned, it can be considered to be Sangha and Vimarga Gamana. Why not Ati Pravritti? Even though he had the vomiting nearly around 7 or 8 times at the beginning. Because so the chardi or vomiting will not occur in each and every individual. Whereas the natural movement of the vatas that will be there from the mouth to anus. So that means from the upward direction towards the downward direction. Suppose if the person is having the excessive diarrhea, water issues, then we can say there is atipravritti. Suppose if the person is having excessive micturition, then we are going to say there is atipravritti. Suppose if the woman is presented with excessive menstruation, then we can say that the lady is having atipravritti. But the vomiting in excessive frequency cannot be considered as atipravritti because it is not its natural occurrence. There must be some kind of the obstruction that will be there. There must be some kind of the srotorodha may be observed in the part of the body. Hence, the thing in this particular occasion, the answer will be Sangha and Vimarga Gamana. Why not Siragranthi? Because Siragranthi, in the sense, there will be some kind of the what you say that the swelling that may be present. Of course, that may be in this particular case that may be absent. Suppose if the person is having the carcinoma of the stomach, etc., then we may expect the Sira Granthi also in that particular situation. In that particular situation, Sira Granthi, Sanga, and Vimarga Gamana may be the possibility. In this way, we have to decode the type of Srotodushti affliction. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement for this particular small message. That's all for today. Something more in the next video. Thank you.